if anyone didn't hear already, this is Dr. Michael Ryan, and I just want to thank her so much for joining us in this lecture. I know, many of our staff have been talking to members, and they were just really interested in hearing a lecture, like this one that details, COVID-19 and going through the cancer experience along with this journey that's already pretty difficult. So Dr. Michael Ryan, she's the clinical director of supportive oncology services at Henry Ford Cancer Institute. And we have really enjoyed working with her, especially getting Durfee going. And so we're just really thankful for you to be here today.
Yeah, happy to be here. Thank you. I will look forward to being able to actually come into the Durfee Center and, do some things hands-on, but this is a good second opportunity.
Definitely. Yeah. Well, thank you so much. And I'm going to just mute myself. And if any problems arise, I'll just kind of chime in if I need to mute anyone.
Okay, no problem.
Thank you so much.
You're welcome. Thank you. So, I've made about 24 slides. I'll really try hard to not exceed more than a couple of minutes on each slide, just so we can kind of get through and then leave real time for, conversation at the end, being able to ask questions or share ideas. And I have a little exercise for us to do as we sort of go through this. The basic topic, talking about sort of cancer support, the necessity of it and the benefits, really, coping with the anxieties and worries, both in the context of not just cancer, but then this new pandemic. It creates a lot of new challenges for people and narrows our worlds a whole lot more than ever were, which comes along with cancer too. So just to identify some goals, and I hope I accomplish all of these things by the time we're done. If I don't, please call me out on it, and we'll go back and try to correct that. But just, I want to sort of define a basic concept regarding coping. I want to talk about what it is, and then without getting too deep into some of my, clinical world and the thought process that I go through, but really put some framework around the types of coping that exist and how you can utilize and work a balance out between the two of them, or the two that we'll talk about as you move forward for strategies to deal with stress. I want to also review some of those strategies about how you cope with the anxieties. And then identify what resources are available and how to access them. And then, of course, at the end, I'd like for us to be able to share some ideas for self-care, about exercise, or how you've been able to stay connected. For this first moment, though, because I know that life is taken a turn in a direction that nobody ever expects or anticipates, I want us all to just take 3 nice deep breaths together. So, and as you're doing it, you can close your eyes even, but just take some nice, calm, deep breaths. And as you are breathing, imagine and think about how you feel while you're breathing, the air going in through your nostrils, down the back of your throat and into your lungs. And then that warmth as you exhale again, as it comes out. And we'll take another deep breath in and out. And one more deep breath in, feeling that rush of air, filling up those lungs, and then the warmth as you exhale. As we begin to go through this, I want everybody that's on with us watching today to just think of one really good way that you can take care of yourself today. And we're going to talk about a whole bunch of different kinds of aspects of that, different ideas specifically, as well as different views of how you care for yourself. So think of something that you might be willing to share down the road. Thanks. Okay, so I want to sort of define what it means to cope, and there's actually a handful of different definitions. I pulled out 2 that I liked pretty well. The first one, this is definitely really a very clinical explanation, but I pulled it out because I really liked this. So it's the cognitive, so the thinking, and then the behavioral efforts that manage, and within manage, it's either master, reduce, or tolerate a troubled person/environment relationship. So that the relationship between the person and the environment. The reason I wanted to pull this one in there because it it's more clinical than I usually like for this kind of talk, but I like that it includes this idea of the efforts that are put forward to either master something, reduce something in your life, or to tolerate it. And those are very important concepts as we cope through different stressors in our lives. And I think the second explanation here, definition, I think is a little bit easier to understand, and just, I like the language in it better for general, sort of non-clinical population. So the cognitive and behavioral strategies that people use to deal with stressful situations or difficult demands, whether they are internal or external. And so that I wanted to pull that kind of concept into it too, thinking about the external, the things that are happening to us, and then the internal, the things that happen within us. And so when we think about external, I mean, COVID is external, getting a cancer diagnosis, those are external things that we can't control that are happening in our environments. And we can only adapt to how we manage those, how we master, reduce, or tolerate those experiences. And then the coping from the internal side, when those external things happen to us, how are we responding internally? So what are our thoughts and our emotions as it relates to those stressors? And so we'll take those ideas through this. We look at both cancer and COVID, all of these external experiences. So cancer and COVID itself, an external experience that is happening. But then because of those things, we have different health changes, changes related to work or school. So many of the social changes, financial challenges are coming up. Obviously, in the context of COVID, there's a lot of unemployment right now, and uncertainty about job security. Insurance changes happen in both contexts, cancer and COVID. So together, it's kind of synergistic. And then all the family changes that can occur. I'm thinking of a variety of things, from role reversals when people get sick and needing to rely on others for assistance, to some of the family challenges that occur within quarantine, either not being able to care for other people that you'd been caring for, or suddenly having to care for others that were unexpected. We're facing some significant challenges in my household, just trying to make sure that the kids do all of their schooling, and it almost seems insurmountable at times, attempting to get through the 17 different items of the day that need to be accomplished. And so I think there's just a lot of change that's happening right now, and it takes quite a bit of practice and dedication to really adapt to it well. And along with that, of course, then are those internal experiences that we have, those internal, just internal experiences, which are the emotions of shock, denial, disbelief, the anxiety, the worry, all of that uncertainty. With this quarantine, I mean, cancer by itself can often result in people feeling very lonely and isolated because others don't really get what you're going through. And sometimes, there's this sense of abandonment as well, because friends that you thought you had, or family members that you really thought would be there for you, seem to scatter when things get more tough. And now with quarantine, we're seeing more and more isolation. It's, I think it's rampant across our population right now. Lots of people, because you don't want to risk getting sick. You don't want to risk having other people potentially getting sick. And so there's a lot more isolation, and that can bring about lots of feelings of loneliness, as well as then that translates into increased sadness, depression, that sense of grief and loss. There can also be a lot of anger during both times, cancer diagnosis and treatment, and now COVID, just one additional layer of frustration on top of an already difficult situation. And then for some people, it's even guilt. I've had patients talk about feeling the burden, or they feel like a burden. I shouldn't say that it is a burden, but feeling like a burden on other people for some of the needs that they have, what related to transportation, or they need groceries or prescriptions picked up, and they feel like they're being an imposition to other people. Those are all really raw emotions that, if not managed well, can build over time and really interfere with somebody's ability to enjoy a good quality of life. And of course, could lead to more significant symptoms, such as a major depressive episode or a severe anxiety disorder that doesn't allow people to function very well in their lives. So there's a couple of different basic types of coping that I wanted to just talk about. So there's really two basic types of coping, and then whether we do active coping or avoiding coping. So the first type of coping is more of a problem-focused strategy. These are more task-oriented strategies where you work toward the root cause of the distress. And so some people, there's lots of different strategies that you can use within this to resolve the problem, such as you think about the situation, you analyze it, you play through scenarios to try to problem solve. For some people, it might be working harder at something to help resolve whatever deficit was presenting itself. Using what you've learned in the past to apply to this particular situation. An example might be, I talk to patients all the time actually when they're having a stressor now and they're feeling very anxious. And they've done therapy before. We always talk about, well, what did you learn back then? Was it helpful for you? What kinds of things did you learn? And then we use the skills that they've developed in the past to apply now, and then we build on those skills as well. And then, talking to somebody that has direct impact to the situation. And sometimes we can problem solve stressors like that. It could be a stressor at work, for example, and by directly having somebody that has direct impact over, for example, a job, or, it could be, trying to think. Yesterday, I'll give this example. Yesterday, I was helping a patient who was nervous about going to start her infusion at the infusion center, and needed some very concrete information about how far the chairs were spaced, how the partitions in between, what the ratio to the nursing staff to patient was. By problem solving through that and talking to the nurse, having her be able to talk to the nurse to gather that information, they could problem solve together to address the issues that she had and come up with solutions to some of the other things that weren't just right for her to feel comfortable. And they were able to do that. And now, she will go to chemotherapy on Tuesday. And I'm hoping things will be okay. And then the other strategies are more emotion focused. And so this will be the internal piece, where there's different types of coping for good or for bad. The list I put here, some people will brood over stressors, where they'll essentially kind of ruminate about it. They don't necessarily get anything done with it. So whether it's a positive coping strategy or negative, it is a strategy that can be used. Some people like to do some imagining or magical thinking. I often do this when I think about winning the lottery, that would solve all the problems. It makes me feel in that moment emotionally better, because that optimism, that positive sort of thinking sort of alleviates strain at that time. And so sometimes doing some imagination or magical thinking can be, at least in the moment, alleviate your strain, even though it doesn't necessarily problem solve everything. Other strategies could be avoidance or denial of the root cause, or from the emotions, blaming, or maybe more positively for emotional strategies is seeking social support, which can be a great outlet for people. And we're going to talk a whole lot more about social support as we move forward. And then, of course, within those different kinds of strategies that we use to cope with more of the external problems and the internal emotions that we experience, there's active coping, which is, of course, the very conscious, intentional attempt to reduce distress or eliminate the sources of the stress. And then there's more of an avoidant coping style, where there's more avoidance, obviously avoidance being avoidant coping, or ignoring the problem. And for some people, the avoidance is an unconscious process that occurs. And so it's not always easy to see, but it is something that can be evaluated and discovered with intent. So we're going to use these concepts as we talk. I broke these next sections down into looking at some of the more problem-focused strategies for coping with stress, and then we'll go through some the things that I categorized as a problem focus, and then get into the emotion focus, and then toward the end it'll and of course I'm talking in all of these contexts as adaptive coping. So this active coping, I don't know that it provides much value to go through all of the maladaptive kinds of coping, although we'll mention some of them. I really want people to be focused on the positive things and the active coping stuff. And we can certainly have conversations about some other coping mechanisms or coping tools that people use, and whether they can be useful in some instances or more harmful long term. So some active and healthy problem-focused coping. With COVID in place, I am going to highlight washing hands, cleaning surfaces, socially distancing, and wearing masks in public. Those are things that you can control. Those are healthy, active ways to solve the root of a problem, to keep yourself safe, and thereby helping in many ways reduce distress. Maybe not to the fullest, because I know that there's a lot of uncertainty out there, but those protections are some of those active coping resources. In addition to that, I definitely recommend maintaining structure and routines as much as you can, regardless of whether COVID was here or not, just through the cancer trajectory. As much structure and routine as you can maintain, as much normalcy as you can maintain through treatment, through survivorship, the better. It provides a source of control when many things in life seem out of control. And routines just help us all get through very stressful times. And it's good to point out that if you have children, or you have grandchildren, any children in your life, the kids thrive on consistency. And so if you're, there's many households right now where their whole routines have been thrown upside down. Mom and dad are trying to work from home. Maybe one of them is going through cancer treatment. Now the kids are at home. There's no scheduled class time, and so because the routines get out of control, then the whole family system gets out of control, and that creates increased stress and anxiety. So it's important then, when you establish routines, that everybody is able to engage in it in one way or the other. You may not be on the same schedule as everybody. Some people are night owls; they just want to be up through the night. But as much as you can maintain, as long as you can establish a routine that is consistent within your household, then you can thrive within that, because it's something that you can count on and rely on. And the more you rely on, the more in control you feel. So it's important to then, schedule activities, making sure that your sleep-wake cycles, the times that you go to bed and the times that you wake up in the morning, they remain the same. It's a very easy time in life, especially with quarantine in place and with so little to be doing. We'll try to come up with some strategies that you don't let your sleep-wake cycle shift too far into the day. It would be easy to sleep until 10, 11, 12 o'clock in the afternoon. Making sure you're getting exercise every day. Maybe planning out weekly meals, so that even having routines within your meal planning provides a degree of consistency that makes life easier. You can rely on that. Every Tuesday it's Taco Tuesday, and it's something that you can look forward to, and you also don't stress out having that plan ahead of time. You're then not stressing trying to come up with new ideas. It's a routine that you get used to. And then other things, scheduling other outlets such as game night and virtual chats, and we'll talk a little bit more about that coming up too. One next recommendation is about move. Get up and move. This regardless. So, COVID aside and COVID plus, but COVID aside, the number one recommendation that I have for people going through treatment or in survivorship is stay active. The more you move, the better off you're going to be, the easier you tolerate treatment, and the quicker you recover afterwards. So getting out and, going for a bike ride, or just walking, even if it's simply walking around the block, or if all you can do is walk down to the end of the driveway and back, then that is something. You can also add in extra steps doing normal chore activity. So when the weather's not so nice outside, thinking about if you're washing the dishes, maybe your routine is, okay, you wash 3 dishes and then you go and you do a lap around the house and you come back and you wash 3 more dishes. And, it will take you a while to get your dishes done. But in that, you're adding an extra activity. And remember that if you're trying to increase your strength in any way, or your endurance, that a challenge will equal change. So if you don't feel challenged, if it's very, then you're not going to be making gains. You have to be a little bit challenged as you go through this. And I put just a sort of an exercise tip sheet here. Hopefully everybody's faces aren't covering over for it, but it just, talks about setting really realistic goals, and then, trying to be active for about an hour a day. That does not necessarily mean that you have to be out running a mile or for an hour a day. It just means the sort of a mild to moderate degree of activity. So that could be walking at a better than slow pace would be a good way to describe it. So keep that in mind. And of course, if you are immunocompromised, then wearing a mask in public would be important while you're out. Sleep is also a really big one when it comes to self-care and being able to cope. If we're not getting enough good sleep, then our bodies don't rest well, they don't heal well, and we have a more difficult time tolerating the stressors that are happening in life. So we know that sleep can be disrupted for a variety of reasons, which could be, anxiety, depression. Sometimes it's based on the cancer location or the type of treatment that you're getting. If there's steroids involved with your treatment, then that can delay sleep onset and can sometimes interfere with quality of sleep. And then sometimes people just don't have great sleep hygiene, and we'll talk about that in the next slide, which are the routines that surround sleep. I brought up before, when we're on quarantine and every day, like Saturdays and Sundays don't matter anymore. Every day just moves into the next day and nobody's really aware of what's happening. Suddenly we're staying up until 11, 12 o'clock in the night and then sleeping later. And the more we allow ourselves to get out of those routines and not have good sleep hygiene routines, the more likely we are to have disruptions in our sleep patterns. So I'll talk a little bit more about that afterwards. And then over on the right-hand side, I just put the basic range for each age range of what's normal, would be a normal sleep routine. And so if you're not falling into one of those categories, then you're either, you could be sleeping too much. If you're sleeping more than, I don't know, I think as an adult, you could probably be sleeping 10 hours a day and still be okay. I think more than that, then we would be concerned about sleeping the day away. The more you sleep, the less you're going to be eating and the less you're going to be moving. And so then you're at risk of not getting enough nutrition, as well as not maintaining your energy levels and your endurance. So trying to really get between that 7 to 9 hours. Getting less than that definitely interferes with your ability to heal well and to cope with stress in life. So those are things to attend to. Sleep hygiene, I won't go through every single one of these in great detail, other than we already talked about having a sleep schedule that's the same even on the weekends, so that you don't get out of a good sleep routine. Exercising earlier in the day, because too late in the day can interfere with your sleep. Of course, avoiding substances like caffeine and nicotine, those are stimulating things, and it can take up to 8 hours to wear off. Alcohol before bed also, although for many people would say, oh, I just have a glass of wine and I'm out. That may be true. The alcohol can help with sedation for sleep onset, but actually alcohol interferes with sleep rhythms and causes you to stay in the lighter stages of sleep throughout the night, and therefore you're more likely to wake up several times through the night. So it really does ultimately interfere with sleep, even though people, tell me all the time, well, I swear by it, 1 glass of wine or whatever, and then they're out. Not a great idea long term. Also avoiding large meals or drinks because of risk of indigestion or frequent urination. Some medicines can interfere with sleep. Things that are stimulating, such as steroids, or some people take things like Ritalin or the stimulants for attention deficit disorders. Those can also interfere with sleep, and so they're usually taken earlier in the day. Not taking naps after 3 p.m. And of course, when you do nap, keeping it under an hour. The cat nap idea, where you sleep for 20 to 30 minutes, is really the most widely accepted idea for napping. Anything more than an hour, you're just going to start interfering with your nighttime sleep routine. I say this also with a caveat that while people go through cancer treatments, sometimes the treatments themselves create such a degree of fatigue that daytime napping becomes normal for a little while, because you just need extra sleep. And so for some people, I just recommend that you keep an eye on it. If you find that you're sleeping your day away and that it does interfere with nighttime sleep at all, then the naps during the day need to be reduced or eliminated. But if you're napping during the day because you really are exhausted and not because you're trying to avoid something, and you're still sleeping fine at night, then the nap is probably necessary based on that stage of treatment. However, when you've completed treatment and things are starting to, should be improving, then those naps also, you should be working to work those out of your day and being more active in the day. Doing some relaxation before bed, so, such as something relaxing, could be listening to music or taking a warm bath. The bath raises your body temperature, and then after a bath or a shower, then your body temperature will fall again, and that helps facilitate sleep. In theory, hopefully it works for you. So that's something that some people like to do. And then making sure, of course, you have a good sleep environment that eliminates noise and bright lights. We always talk about not using electronics before bedtime either. That the blue light can disrupt normal sleep-wake cycles. And so, making sure maybe turning off those electronics a couple of hours before you would go to bed, and doing something like reading a book or doing a puzzle would be a smarter thing to do. And then making sure also that you get enough sunlight exposure. Of course, wearing sunscreen, but getting about 30 minutes a day of indirect sunlight does also help regulate your sleep patterns. Good nutrition is also very important. Again, so we're talking about those problem-focused solutions or strategies for managing stress. Some of the ways that you can tell if food or nutrition or food is something you're using to cope with stress, either because you're over or under eating, or because you're eating for long periods of time. If you find yourself doing that under eating, I also recognize within cancer treatment, sometimes people don't have appetites, or because of the type of cancer or treatment they're having, makes it difficult to eat. So I say that with this caveat to it. But it's not uncommon for people to either stress eat or not eat because of stress. And so paying attention to those two mechanisms in your life and deciding what's going on. But we do know that getting good, healthy nutrition, of eating a really balanced diet and avoiding alcohol, can help you feel better physically. It helps maintain your energy. It reduces the risk of getting an infection, and then it also helps you heal and recover more quickly from any treatments that you might have or injuries you might have. Relaxation would be another strategy, active relaxation. We did just a deep breathing exercise, very basic, and it was also very short. Many of these mindfulness meditations or guided imagery, they're often only a few minutes at a time. I mean, even just doing a minute or two of a relaxing activity has a good carryover effect to managing stress the rest of the day. And it's also a skill that you can use over and over and over again. So I put here the couple of pictures that you see. There's the Calm website. So if you have a smartphone, or if you just want to go online, Calm, and then this other one, Headspace, right next to it. Actually, Headspace released some additional apps or additional links within its app and online that is specific to Michigan. And so you see at the bottom, it says stay home, stay mindful. And these are intended to more for Michigan based. So they put, I think, some Michigan scenes on there, and it was a really kind of a thoughtful thing that they worked on to release them to Michiganders specifically to help everybody cope with, how we've been hit with the COVID. Other ideas include listening to music, or running water is often a nice serene sound for people to listen to, getting a massage, having a snuggle, and it could be with anything, your favorite pillow, your favorite person, or even, your cat or your dog, it doesn't matter. But, having that sense of that intimacy helps lower respiration rate, helps lower our heart rates, and helps us feel a little more peace on the inside. And of course, taking a warm bath or shower and then doing some stretching, or you could do online yoga with Gilda's Club. Staying connected with other people. This is both, and I think this will play over into both an emotional, how we deal with the emotional aspects, internal strategies, as well as the more the problem-focused things. And so, when we talk about staying connected, right now we have a physical distance requirements, but not total distance. And so we know that the loneliness can create more stress. And so it's important that we even schedule visits that we have to look forward to, and look for those outlets to be able to stay connected with people. I recognize, well, everybody here appears to have access online. You've got internet access, and we're at least staying connected right like this. So this is great. You're streets ahead of others out there. But if you've got family members or friends that need some advice, doing regular phone calls or texts, video chats, I think even having those things every Sunday at 10 a.m., we talk to so-and-so, and use the resources that are online to stay connected virtually the best that you can. I threw in a couple of photos here of how people are staying connected virtually. I like this one. There was a picture taken outside of or through somebody's window, where the neighbors, the guys, were just getting together and all standing 6 feet apart, so that they could still do I think they probably got together on a weekly basis anyway to have lunch or play poker or whatever. And here they are able to engage in conversation and not risk each other's health. Also then, another problem-focused strategy would be limiting your exposure to the news and the media. This can be really big triggers for anxiety, and I will admit that I am equally guilty in this, especially earlier on. I think I've become more self-aware over the last couple of weeks, to just know that it almost becomes obsessive to find out what's going on, and the media really sensationalizes a lot of information, so that it keeps us coming back for more, because but all it does in that instant then is triggers higher anxiety and makes it harder for us, and we start thinking those future what if scenarios that are catastrophic. And so really making sure that if it's important that you stay informed, and so finding that balance of moderation to set boundaries for yourself, so you know when and how much news you're okay with, and realistically, maybe once a day for 10 or 15 minutes is the maximum that any one person can tolerate. And so schedule that. Maybe it's one particular news program that you're going to watch, and then the rest of the day it's electronics off, the news is off, just so that you don't you're cycling through the same news over and over and over again. And each story is intended to be as titillating as it possibly can, because they want viewers, they want people to pay attention. But it often is creating nothing but wreaking havoc on the emotional states of people. So yeah, establish some boundaries, decide what's going to be good for you, and maybe test some things out. Try out a couple of days of just maybe it's once a day and it's in the middle of the afternoon, so that you can get the daily news cycles can cycle already, and you can get the information that's been accumulated for the day in a short period of time. And then the rest of the time, making sure that you have other activities to distract yourself with, and really sticking to that, and see how it goes, maybe, and see if your anxiety levels come down a bit. And then, of course, choosing your sources of information carefully. And this goes, I mean, this is obviously true for anything that you need scientific evidence to support, or that you want truth and true evidence to support. So whether it be the American Cancer Society, the National Institutes of Health, the WHO, the CDC, just WebMD and Wikipedia are not great sources for information. So now we can get into some of the emotion focused. Oh, good. I need to talk a little quicker. I've been going on and on. More emotion focused coping, which injecting fun and humor into your life. I put a little, 5-year-old joke up there. He laughed pretty hard when he saw that, or when I read it to him. Find opportunities to figure out where to put fun and humor into your day, even when things are stressful. There are always opportunities, and maybe it's going online to read a joke of the day. You could Google something like that, or maybe you can involve friends and family on how you could just have a little more whimsy in your life. Showing gratitude is also another really great way to manage emotions, because gratitude creates more positive emotions, and we know that from research that those who show higher rates of gratitude also demonstrate lower levels of perceived distress. In similar studies, they've also seen that those who identify as being more grateful also demonstrate better immune response under a variety of circumstances, which I won't get onto all the studies today. But there is at least some scientific evidence to support this. And so, I think it goes along with the mentality more of like instead of the glass being half empty, the glass is half full. And so being thankful, being grateful for things in life helps you gives you perspective on, you create a comparison. Things, when you think you're grateful, things could be worse. I guess my family does this all the time, and I hope that yours does as well. And we compare ourselves to other situations, and that gives you that perspective that you need to know that things are not as bad as they could be, and that I guess it gives you a leg up. It creates more positive emotions. Using your social support. So here's some of the science behind it, is that regardless of whether or not the social support is even that good, if you perceive that you have good social support, if you believe that you have good social support, then generally speaking, your overall level of distress is lower. We also know that those who have good perceived social support show slower tumor growth and a better response to treatment than those people who perceive less social support and therefore are more distressed. So the social support really mediates the level of distress that people experience, and from that it can have it has affects then our response for tumor growth, for cell turnover, and then for response to treatment. So I think it's a really interesting and important idea to ingest and really then to evaluate the social support. And actually, I've seen some circumstances from an objective outsider's point of view where I think, oh God, they have such terrible social support. It's so minimal, but the individual really thinks they've got great social support, and so then they aren't really have the same level of distress, and they're able to cope with what they're going through much easier. So it's pretty fascinating. We also know that that having good social support, or at least good perceived social support, is linked with better health behaviors, such as those people who have good social support are less likely to engage in behaviors that set them up for developing cancer. For example, people who don't have great social support are more likely to eat unhealthy foods, not exercise, smoke cigarettes, drink too much alcohol. And so it increases their vulnerability to cancer specifically, but as well as other health conditions. And then we also know that social support, because of that, then impacts mortality rates. The more social support you perceive, the better your overall health ends up being. And then we also know that the higher a patient's distress is, then the higher the caregiver burnout is. So if we keep this back, keep connecting it back to social support, if a patient, for example, or any individual perceives that they have very good social support, then their distress levels are going to be lower. And therefore, if a patient is less distressed, then their caregivers are going to be less distressed. Uh, we know that when caregivers get burned out, they have a decreased ability to provide good care to the patient. And then the patient's distress goes up because their social support isn't so good. So I think this demonstrates the cyclical pattern that occurs, that if there's good social support in place and the patient's level of distress is lower, which lowers the risk of burnout for the caregiver, which increases sort of the immune response for the patient, which helps their outcomes overall. So it's it's an important sort of cycle that occurs, and then addressing good and having good sources of social support. This doesn't have to be a spouse or a parent or anything like that. There are lots of sources of social support, which we'll talk about in a minute. But it's important to have that social support so that the level of distress and burnout is then reduced. So many different sources: friends, family, support groups, which we're here today doing with an online resource, lots of educational resources, faith communities, all kinds of different sources. Specifically, I want to call out our community resources, such as Gilda's Club, Immerman Angels, the American Cancer Society. Cancercare.org is another great resource where they've got social workers and they've got phone support groups. They're probably starting some online stuff, which I admit I haven't checked recently. Within Henry Ford Cancer Institute, where I work, we have a variety of supportive resources for our survivorship community. We're doing a lot of online education, today being one of them, but ways for us to be connected and stay connected and provide the kind of support that people may not naturally have at home for whatever reason. I, of course, want to call out Gilda's Club in great detail. They have just an inordinate, during this time, amount of support resources available through support groups and a lot of their health and wellness education. We talked earlier, if you were on already, about the yoga and the Zumba classes. I know that they do nutrition classes, and if anybody needs to talk to a social worker one-on-one, they provide those resources as well. So Gilda's Club has been a great partner and a great resource, and obviously just about everybody that's online here is well aware of Gilda's Club, so I hope that you can continue to use it because it's such a wonderful support resource. Immerman Angels is another really great resource as well. They do something very unique in that they provide one-to-one mentorship. The goal being that they're able to match you as closely as possible with somebody that has essentially been there, done that, to whatever degree. And recognizing that not every mentor is going to have every experience that the person who needs the mentee needs, but they really do have a good understanding, and they're all trained and vetted and usually long-term mentors. So another wonderful resource that can easily be found online for people to use. So the support resources in that last slide that I had you take a look at, it's a really great resource for that emotional support. Being able to talk about your feelings can help reduce that sense of distress and loneliness. Through the different resources they have available, you learn different types of coping strategies, many of which we've talked about today, but even more strategies because people share novel ideas that we don't necessarily always think about. And we know that using those support resources help reduce the risk of serious symptoms, such as a transition from sort of mild anxiety, loneliness into more a depressive episode or an anxiety problem that needs to be managed at a higher level. Through using the use of those support resources, they help connect you to more needed resources, such as some of the more practical and emotional things that might occur. And they provide valuable education, advocacy, and then just improve overall perceived quality of life. So I can't say enough good things about all of the community resources that are available, particularly within Gilda's Club. So And of course, I'm a psychologist, so I have to point out when I would want people to be talking with their doctor. And that, of course, would be if any mood symptoms start to interfere with their relationships, normal daily activities, or meeting your healthcare needs, any feelings of hopelessness at all, and then, of course, any thoughts about suicide. Those would be times to reach out to your doctor for an appropriate referral. Within the Cancer Institute, we have a psych-oncology group that can certainly help out with those things, and the Gilda's Club crew know that they can refer to us, and we also in turn refer to them for patient resources. And so that's the end. Right there. Let me see, what time is it? Ooh, 2:53. We're doing pretty good. Does anybody have? Hi, thanks, Rebecca.
Thank you so much. That was awesome, super valuable. We're going to open it up to if any of our members want to, let me get my screen back up here. If any of our members have any questions, there is a little chat dialog box at the bottom of your screen. Or I can just unmute everyone. Let me see if I can do that easily here. Still getting the hang of it.
Yeah. That's why I had you be in charge. I don't know what I'm doing.
Yeah. I'm just going to go ahead and unmute everyone. If you're comfortable with that and you have a question, feel free to ask it out loud. Or if you'd rather, type it in the chat box below, that's totally fine too. We'll just give a couple minutes if anyone has any questions.
Yes, you got any questions?
Well, maybe not. Thank you so much, Dr. Michael Ryan. That was awesome, very helpful.
Okay.
Some really good strategies, not only resources in the community and with Gilda's Club, but just personal coping strategies, stress relief, sleep, and all of those things. I don't see any chats in the box, so I don't think anyone really has any questions at this time, but what we can do is if anybody does have any further questions, you're free to email me. I'll looks like we have one here. Oh, Laura said very helpful, thank you.
Okay.
I'm just gonna type my email in the chat box. That way, if anyone has any questions for myself or Dr. Ryan, you can just type them here and email me, and then I can follow up with you. Well, thank you so much. We really appreciate you being with us today. I know so many members had concerns of just, worry and frustration with everything going on. So it's really great to hear from a professional.
This says, and actually I forgot too. So there's a question here from Angela that says, any suggestion for physical activities given the unstable weather? Great. So yeah, this for sure. There's different ideas. I talked about adding in extra steps, for example, during normal chore activities. Whether it be doing laundry, you could walk up the stairs a couple extra times. But one of the things I forgot is I wanted to go back to that initial question about being able to share that one thing that you're going to do today for self-care. And I wonder if anybody in the group actually has any good ideas, something that they've come up with over the last few weeks as they've struggled to stay active indoors.
Does anyone want to share maybe what's been working for them? I know for myself, I've been taking quite a few walks, which I normally don't get to do. So that's been really nice. And just to reiterate, we've both mentioned, but we are offering yoga twice a week virtually. I believe it's Mondays and Saturdays. And then we also have Zumba on Fridays. And then we do meditation as well. Maybe not something you've done in the past, but it could be fun to try something new for sure. I think we have one more question here. Oh, Laura said, I've been bundling up and walking outside.
Yeah, as have we. I'm trying to think of what other things. So I've find myself occasionally trying to get down and do things like girly push-ups and that kind of stuff, just to keep the muscles intact. Yeah, gosh, I wish I had some really great ideas. We do, so I have 3 young children, and so we've been working really hard to keep them active. And you're right, the weather has been unstable. We will do some daily stretching in our house, and my husband and I will completely embarrass ourselves. And today is Saturday, so we do our Saturday dance, which I will not share because it's really just for our family. It's so embarrassing. But just those kinds of things, it helps. Obviously, it distracts us for a few minutes. But even, sort of dancing around the house and wiggling around with kids does get us a little bit of more activity. So
awesome. Yes, I know many people are struggling to keep their kids active and engaged right now, so that is a good pointer.
yeah, but getting out and walking with pets as well. And there's there's other options. I think even Netflix runs has some exercise programs, or at least stretching and meditation kinds of things. So that could be done if you've got some of these other online platforms. And all kinds of things online. If you just Google something, you can always find YouTube videos of how to stay active at home by doing stretching, or the Zumba or jazzercise kinds of things.
Yes, YouTube is limitless potential with things.
Exactly. Yes.
So.
Yeah. Full of cocoa melon, if anybody knows what that is. Did anybody want to share anything that they would do today or this weekend? Maybe something that wasn't talked about today that is another great example of sort of that self-care. Oh, that's a good idea. So Megan just shared, you can do a step bet too. It's an app that holds you accountable to get a certain amount of steps. Yep, good idea. Oh, okay. And then Nancy's asking about the Excite program isn't running right now. Although, did I see Dennis on the line? Dennis Kerrigan, did I see you there? Maybe not. I saw his name come up a second ago. He was trying to sign up for the Excite program, but they didn't think it's safe. What can I do? So yeah, taking advantage, you could do, in the Excite program, the goal would be that you'd have an exercise physiologist to help you manage. But at home, if things like a stationary bike, going for walks, those things would be good to do. Or doing some sort of video program at home, like some yoga, would be also a good thing. You can even do chair yoga depending on your level of flexibility and endurance. Well, and yes, as Carrie points out, it is not meeting right now. The Excite program has also been put on hold until the quarantine stuff is up. So we're waiting on that. That's actually why I was hoping that Dennis was still on, so he could comment on where we sit with that. Let's see, Excite has online videos you can use as well. Well, Carrie, can you share that information with us? Where can they find that?
Yes, I can share that information. I am trying to find the link right now. They have their own playlist on our Henry Ford YouTube channel. So I'll
that's
find
fantastic.
Yes.
Well, there you go. Megan, why don't you give that a try? Carrie will send that over so you can have it.
I'm looking.
Yeah, cool. Thank you.
Mm-hmm.
Perfect. Does anyone else have any comments or questions or want to share anything that's been working for them?
No? Okay.
Carrie, if you don't mind sending me that link, I can also send it out too if anyone follows up.
Yeah, no problem. And I found Excite has their own videos, and then we also just have other at-home videos that Henry Ford put out. So I'll just send that link along.
Thank you, Carrie.
Mm-hmm.
That's great. I didn't know that Excite had their videos online, so that's awesome, and I'll be able to use that regularly now.
Perfect. Well, thank you so very much. And if anybody doesn't want to ask something now, or if something comes to them later, feel free to email me. And I can always get the questions to Dr. Ryan, and we can get you the answers that we have. So thank you so much, everyone, for joining us. And thank you so much, Dr. Ryan. We really appreciate it.
My pleasure. I'm glad we got to do this. Yeah. So keep in contact, and if maybe we can do something again in another month or so.
That would be awesome. Thank you so much.
All right. You're welcome.
Everyone has a good Saturday.
All right. Thanks. Bye-bye.
Bye-bye.